Checklist for outlet forceps delivery A to J mnemonic. A is asking for help. The total number of help personnel required is 5. 1 to bring the instrument tray, catheter tray and episiotomy tray. Another staff member to call the neonatologist and OR team. 1 staff for scribe, 1 staff for supporting the perineum and 1 for carrying out the AMTSL. When we are calling out for help, the trigger word is call out for outlet forceps requirement mentioning the bed number. B stands for bladder empty. C for cervix membranes absent and the cervix is fully dilated. D to determine the position of the occiput, the complete rotation and the station of the presenting part in relation to the ischial spine. E is the equipment check, that is the forceps here. F for forceps, the phantom application in front of the mother, whether we have selected the right blades or not. G for gentle traction. While giving traction, it is always a good practice to assess for the descent of the presenting part. H is to halt when the mother is not experiencing contractions, when there is no descent of the presenting part, that is the head, and when the blades are not easily locking. I is incision, that is the episiotomy mediolateral, and J is the time when the jaw of the baby is delivered. At that point the blades are unlocked. Phantom application. This happens in front of the mother. So for this I am holding the right blade mentioned as R in the right hand, the left forceps blade mentioned as L in the left hand. I am placing in front of the mother. I am able to lock it easily and the tips are pointing upwards. That means these are the correct blades. The equipment check has been done. Demonstration of forceps application. For that, the first blade that will be introduced is the left blade. I am holding the left blade with my left hand. Okay, and then the shank of the forceps is parallel to the maternal right inguinal ligament here, and the blade is resting on my left hand in the palm. I place 2 fingers in the vagina using my right hand. These fingers are placed to guide the blade. Now gently I am advancing the blade into the maternal pelvis. Now my thumb is moving towards the heel of the blade. Now my fingers are guiding it in such a way the left blade is now occupying the left side of the maternal pelvis. Place the left blade. Now I request Dr. Ramya, can you stabilize the left blade?
Yes, ma'am, stabilizing the left blade.
Thank you for stabilizing the left blade. Now I am holding the right blade with my right hand. The shank is parallel to the mother's left inguinal ligament. This is my left hand, placing it against the left hand palm, introducing my fingers into the posterior aspect of the maternal pelvis. Now I am sliding it along the fingers. My fingers are moving now towards the maternal right side. The thumb of the left hand is now going to the heel of the blade. Now I am advancing it and then I am locking the blades easily. Blade of the forceps. The left blade is already in. It is being stabilized by Dr. Ramya. Now I am holding the right blade with my right hand. The shank is parallel to the mother's left inguinal ligament. Now I am placing my fingers in the vagina, occupying the right lateral quadrant of the maternal pelvis. the tip of the blade is now resting in the palm of my left hand. I am sliding it. Now my thumb is placed at the heel of the blade. I am advancing it till the whole blade is inserted. I remove my guiding fingers now. I am locking it successfully. Checking for the correct application of the forceps blades before giving traction. For this, I am using the relationship between the posterior fontanella and the shanks, the lambdoid sutures, its relation with the blades, the sagittal suture and its relation to the shanks. So to go with the first structure, that is the posterior fontanella, it should be in the midway. So it is in the midway, and the distance between the posterior fontanella and the shanks should be 1 finger breadth. It is 1 finger breadth. Now moving on to the lambdoid suture, they should be equidistant from the blades, and 1 finger breadth between the lambdoid suture and the blade, 1 finger breadth between the lambdoid suture and the blade. Coming to the sagittal suture, it should be in the midline. Yes, it is in the midline, and it should be 1 finger breadth from the in relation to the shanks. So it is 1 finger breadth in relation to the shanks, and then it should be perpendicular to the shanks. So of the accoucher, the accoucher should be in sitting position with the elbows flexed. The purpose is so that the force comes from the hands at the level of the wrist joint, not from the forearm or the upper arm. Holding it in the right underhand position with the left hand on the shanks. This is how the accoucher is expected to sit for the application of the outlet forceps delivery. Demonstration of gentle traction. Having confirmed that the blades have been applied correctly, I am giving the gentle traction only when the mother is experiencing pain, and also when the mother is putting efforts of bearing down. Only at that time I am giving traction. The way I am holding it is the underhand right hand grip. That means to say my index finger is coming from below, getting inside. All other fingers are being used to hold the handle of the blade. My left hand goes in front of the shank. This is to apply slight downward traction. Now, when the mother is experiencing pain, can you please tell me if you are having pain?
Yes,
Mrs. Geeta?
It's paining.
Okay, so she has a contraction. Can you push, Geeta? Take a deep breath and can you push? So now I am giving gentle traction first forwards, that is towards me, and once the occiput hitches under the symphysis pubis, I am giving first, I finish with the forward traction. Now I am going to give a upward traction to a 45 degree and to a maximum of 75 degree. After that, once the jaw of the baby is delivered, now I unlock and remove the blades. For this, I will be removing the right blade first. When we have applied, it was the left blade first, and then turning it around and removing. Now I remove the left blade. I go in the opposite direction and then remove the blade.